When I think of the word father, I think of brave, courageous, strong, leader. And all of those words are a perfect way to describe our guest today. His name is Kapil Kumar, and he is the proud father of a 22 cutie named Niam. He is the vice president of the 22Q Family Foundation, but he is so much more than that. He is a dedicated father and a fierce advocate for his son. And today he shares his journey of struggles and triumphs with his son. And I'm so honored to introduce you to Kapil. Welcome to the 22Q podcast. My name is Becky White, and today I am thrilled to have Kapil with us today. He is a dad and an advocate for all things 22Q. So welcome, Kapil.
Thank you. Great to be here.
So honored to have you. Our paths sort of crossed through the 22Q Family Foundation. I had the honor of meeting your wife at the first 22Q Moms Retreat. So I'm so honored to have you on today to share your story and your perspective as a dad with a 22Q child. So welcome, and I'd love for you to introduce yourself to everyone.
Thank you. Yeah. So I'm Kapil Kumar. I've been part of the 22Q community since our son was diagnosed kind of 20 weeks into the pregnancy back in 2014. And he's almost 9 now, which is crazy. Becky, I think you said your son is about the same, right? About a month off.
Mm-hmm.
Yeah, he's doing well. He had truncus arteriosus when he was born. You know, when he was diagnosed with 22q deletion syndrome, it was because of the heart defect. They saw the heart defect first, and they said, 60% of kids that have 22q roughly have congenital heart defects. So let's just go ahead and test for it. So we live in Chicago. We were very lucky to be near Lurie Children's Hospital, and that's kind of been our home hospital. We live right in the city, so it's close by, it's convenient. It makes it really easy to get all of the care that he needs. Throughout the years, he's had a variety of different procedures. He had truncus arteriosus. He had the open heart surgery on day 4. He's had 3 or 4 ear tubes put in. He's had a G tube. He had an ear reconstruction. The list kind of goes on. But yeah. I think that's common for any of the families to 22q, that, there's a long list of symptoms and potential commonalities. And so it's hard to spot them all.
Right. And can you tell me the first diagnosis? You said I'm going to pronounce it.
So truncus arteriosus.
Yeah. What is that?
It's a heart defect where the lower chambers of the heart, the wall in between them, isn't fully formed. So what happens is the blood mixes and it pumps oxygenated blood throughout the body, including the oxygenated blood.
Wow. So, and did you find that out in utero?
We found it out in utero. So he was probably one of the most photographed or scanned kids in history. He had weekly echoes almost going into the last couple weeks of the pregnancy. He was doing we were scanning lots and lots to make sure that his heart was doing well and ready for birth. And so yeah, when he was born, the teams were all ready to go. In the labor and delivery ward, they had all of the doctors come up from Lurie Children's, and Prentice is the women's hospital, and it's attached to Lurie Children's. So they were able to just bring him over right away. As parents, it's tough because you got like 5 minutes with him and then they whisked him off. So it was atypical, but it was our first pregnancy. So we didn't know any better.
Right. Yeah. And when you got that 20-week ultrasound, was that the first thing they saw, or did they see the hole in the heart first?
No, so they spent a little bit of time, and I think they saw the hole first, and then they were able to kind of dig in further. They have neonatal cardiologists that can do CAT scans, or actually echoes, while the baby is still in utero.
Isn't that amazing? That's great.
Technology's crazy.
Yeah. And when you guys got that diagnosis, and this was your first child, what was that like for you as a dad?
Well, it was kind of awkward because it happened to be Halloween, and the doctor walked in a fairy costume.
No.
That was fascinating. But, for everyone, the first reaction is usually shock and confusion. What does this mean? What do we do now? What is 22q? How is this going to affect our child's life? How is this going to affect our life? So, I think we went through that normal mix of emotions, and, we're like, look, we're lucky that we don't see any other challenges right now that are major kind of abnormalities or differences from an anatomical perspective. And
Mhm.
so, there's a lot of issues with kids with 22q that have cleft palate or a variety of other palate issues. They can have a lot of other challenges with organs not forming properly, kidney issues, other feeding issues. So, the list goes on, and we're like, okay, we're going to figure this out as we go, right? That's the only option. It's like when people tell you, well, I could never have dealt with that. Well, yes, you could have. If you're in that position and your child was sick, you have no other choice. You're going to deal with it.
Mhm.
So it's fine.
Mhm. And you're very fortunate, like, as you said, that you're in Chicago, had a lot of great medical support
Yeah.
and guidance too.
Yes, yes. And so at the time, Lindsay Garcia and Ryan Garcia, they're the ones that took over the 22Q Family Foundation from Ryan Dempster back in the day. They were still in Chicago, so we got to, kind of hear from their story, hear from their experience, learn about the foundation. So I'm actually on a number of nonprofits as well related to 22Q. Part of it is the 22Q Family Foundation. I'm the vice president, and there's only 3 of us right now that are kind of operating it, but we try to do a lot. Our 3 main tenets are kind of education, awareness, and connection. And so the goal is to find ways to help people understand the educational landscape, to provide educational consulting through our expert, Donna Cutler-Landsman. She actually wrote the book on educating kids at 22Q. So that's the education component. The connection component is pretty easy. We want to get people together to share their stories and to bond. And I think the Moms Retreat is a great example of that you brought up earlier, Becky. And then, the third part is awareness. And that's what all of us are trying to do, especially with your podcast, is raise awareness about 22q. It's the second most common genetic difference, and it's just following Down syndrome. So it's scary and odd that people don't know more about it, with it being so common. But as I'm sure you've covered in the past, it's so hard to diagnose because there's such a myriad of symptoms. So
Yeah.
aside from
Yeah.
that, I spend time at Lurie Children's Hospital, their Family Partnership Council. There's a few other organizations or groups within Lurie's Pediatric Surgical Experience Advisory Boards, their Quality Safety Oversight Committee. So the goal there is not only to improve patient experience and patient care, but also to raise awareness about 22q through those avenues.
And did Lindsay approach you with the 22Q Family Foundation, or did you kind of raise your hand and say, how can I be on the board? How did that happen?
Yeah, so it started off as a process to have a zoo event for 22Q, the 22Q at the zoo in May. And I asked Lindsay, look, the International Foundation isn't really helping me with organizing this and getting funds in. So will you help me? People can donate to you with this hashtag, and then we can allocate the funds for the zoo. And so we started with that. We started talking a little bit about what they were working on and the things they were having challenges with. And I was like, let's just keep having conversations and see where it goes. And about a year into our relationship there, Lindsay was like, would you mind joining the board? Would you help us? And I was thrilled to. I'm a serial board member to some degree. I like to join everything. Yeah, right. I like to join everything and be president of everything. And so this was a great opportunity to really find a way to give back. One of the programs that I was really excited about through Lurie Children's was a program called Parent Wise. It's Parent Wisdom in Shared Experience. So it's a really great moniker. They pair you with families that have just gotten diagnosed. And then you can have conversations with them one-on-one to help them walk through the process of what you've been through. And so I like that one-to-one kind of outreach aspect as opposed to some of the social media that a lot of people are on. And so the Family Foundation was a great way to do that. It's a great way to actually connect with people as opposed to large groups and large swaths at one time.
Right. So you're on the board. How long have you been on the board?
It's a good question. I think it's been about 3 years now.
Nice. And if anybody else is interested or curious,
we're always looking for members.
Okay.
We want people to come join us. We want people to come talk to us. We are looking to not only work on expanding our list of resources from an advisory board perspective. We're looking for medical professionals to help us curate the content on our website and help find studies. We're always looking for guests for our various kind of speaker series that we have. And so there's a lot of great stuff happening. So if you want to volunteer, there's definitely opportunities.
And how can they reach you if they do?
Best way is to email info@22qfamilyfoundation.org. So that's info@ 22qfamilyfoundation.org.
Awesome. And I'll put that in the description so people can click on it. And if they want to learn more and get involved.
Yeah.
And we always want that, because the more people involved, the better, because each one of us is a tree to other people.
Absolutely.
Just to educate them, even
Absolutely.
but we love those people that are doers that want to get involved. So
we're looking for all of them.
If you're one of those people, or if you want to step out of your comfort zone and you're listening to this and you think, what can I do to help others? This is a great way. So check it out. So I'd love to dive back into your story a little bit more.
Yeah.
Can you tell us a little bit more about your son? What is he like?
Yeah, so I mean, he's just a goofball. He's funny. He loves PJ Masks and now Spider-Man, and he's kind of venturing out into the Marvel universe a little bit, which is great. And he's just a really loving kid. He's always up for a hug. He's always, playing and smiling. He has a sister that's about 18 months younger than him, and so the two of them get along like twins. No one can bother the other without getting in trouble with the first. So they can give each other as hard a time as they want, but anyone else steps in the mix, you better watch out.
Oh,
so
that's great.
He's in second grade now, and we have a full-time aide for him in the classroom. I think one of the most challenging things for navigating 22Q was figuring out the right schools for Niam. We live on the south side of Chicago. The public schools aren't really great, and we were trying to figure out the right place to put him. And it's hard. We went through the IEP process, and Chicago public schools, they have like one counselor for 5 schools or 10 schools. They have a nurse that comes for a half a day once a week. And it's hard knowing that your child is going to need additional help. And you don't know what that is when they're 2 or 3 years old. They're not talking yet. They're not up and about yet. So it's a challenge. And so we visited a number of schools around us in the area, both kind of public, private, some parochial schools, to figure out what is the right fit and where is he going to have the right supports. So we were very lucky to find Ancona School, which is just a few blocks from us. And it's an independent school that focuses on social justice and diversity, and both learning and ethnicity. And so we thought it was a really great place to start. And we would kind of see how it went. And they were really, really engaging with us, and really accommodative in that, look, we'll both try it out for a year and see how it goes. And then if we need to make changes, we can make changes. If he needs more supports, we can figure out those supports. So that was really comforting to know. And we just wanted him in an environment that was safe for him and that tried to reduce his anxiety. So we worked with the teachers a lot to try and see, where are the challenges? What are you noticing? Where is he not engaging? Where is he engaging? And so he did well through, kind of pre-primary and kindergarten, and first grade. And we decided that, it's time now to try out having a one-to-one aide with him, just to see if we can get some more insight on what works in the classroom, what doesn't work in the classroom, what are his real challenges, to then work with other occupational therapists, speech therapists, developmental therapists, whatever it may be, to try and fill those holes, in addition to the work that he's doing in the classroom.
Right. And I think it's great what you said, is that you'll see how it goes. You'll test it out, because with our kiddos being 22Q and all of the things they need, that's the way you have to operate, I've found personally. And I think it's a great mindset to have, because especially with school, because you never know what the right fit's going to be. And you could eventually, he will change, and the atmosphere might need to change. So I think that's a really great point that you made.
I think that, I grew up in an Asian household, right? An Indian household where grades were basically all that mattered. And, you better get a 4.0 and you better do well on every test and score high on standardized exams. And it created a lot of anxiety for me, and I didn't even realize it at the time. And so at first we found a preschool that actually did like multiplication tables and vocab words starting at 3 years old. And I was like, yeah, that's awesome. And then that was before Niam was born, I think. And then, he came along, and I'm like, you know what? I don't want him to have that tension and that stress on him. They're already predisposed to anxiety. So let's find what works for him to make him his best self. And that's what we always try and go for, is what is going to make him his best self, not a vision of what we want him to be or what we hope he'll be, but just to be happy and content with his own abilities.
I love what you just said. Find out what works for him, because that takes courage, to even say as parents, because we do have this vision in our head before we are going to become parents of what we envision. And then when, I know for me, for example, when we had our son, that vision sort of faded away and it had to change because of the diagnosis we received. So I think that's really important. Find out what works for him. And I think that's beautifully said. And changing your expectations and being okay with it. And that takes time.
It does. Have you read the poem, Welcome to Holland?
Yes.
So that's one of my favorites, and I try to use it with all parents. So for those that haven't read it, check it out. It's by Emily Pearl Kingsley, Welcome to Holland. It's all over the internet. You can Google it and it comes right up. But basically the idea is, look, all of my friends are going to Italy and they're having this amazing experience and this amazing trip with all of these fantastic things to see. And that's all they're talking about. And I'm excited to go there. So I get on the plane and we land in Holland. I'm like, Holland, what is this? Why am I here? It's different. And the bottom line is that, yes, it's different, but it's not worse. It's not worse or better. It's different, and it has its own qualities, its own unique abilities, its own unique, beautiful things and beautiful challenges. And so it's a great way to kind of encapsulate how people can process that kind of starting off.
I wanted to share with our listeners, if you hadn't heard the poem, Welcome to Holland, here it is, by Emily Pearl Kingsley. I am often asked to describe the experience of raising a child with a disability, to try to help people who have not shared that unique experience to understand it, to imagine how it would feel. It's like this. When you're going to have a baby, it's like planning a fabulous vacation to Italy. You buy a bunch of guidebooks and make your wonderful plans. The Colosseum, the Michelangelo David, the gondolas in Venice. You may learn some handy phrases in Italian. It's all very exciting. After months of eager anticipation, the day finally arrives. You pack your bags and off you go. Several hours later, the plane lands. The stewardess comes to say, "Welcome to Holland." Holland, you say. What do you mean, Holland? I signed up for Italy. I'm supposed to be in Italy. All my life, I've dreamed of going to Italy. But there's been a change in the flight plan. They've landed in Holland, and there you must stay. The important thing is that they haven't taken off to a horrible, disgusting, filthy place full of pestilence, famine, and disease. It's just a different place. So you must go out and buy new guidebooks, and you must learn a whole new language, and you will meet a whole new group of people you would never have met. It's just a different place. It's slower paced than Italy, less flashy than Italy, but after you've been there for a while and you catch your breath, you look around and you begin to notice that Holland has windmills, and Holland has tulips. Holland even has Rembrandts. But everyone you know is busy coming and going from Italy, and they're all bragging about what a wonderful time they've had. And for the rest of your life, you will say, yes, that's where I was supposed to go. That's what I had planned. And the pain of that will never, ever, ever go away. Because the loss of the dream is a very, very significant loss. But if you spend your life mourning the fact that you didn't get to Italy, you may never be free to enjoy the very special and very lovely things about Holland. Yeah, they had that hanging up in the Family Center at Boston Children's Hospital. And I was reading it, like tears coming down my face, because that's true. You have this expectation. You've read all the Italy books. Exactly. You know what tourist spots to go to in reference to having a new child, and then you get your world gets flipped upside down. And then you just start to try to find a translator. You try to find
Yep.
where we need to go, the support systems. And how did you navigate that personally? How did you work through those feelings of landing in Holland when your son was born and learning to navigate it?
So my wife and I actually pair really well together. If one is kind of at a place of tension, the other one hopefully is a little bit more calm. Or at least this was when they were born, before we were, before we had a 7 and 9-year-old, we were able to process these things. And it was great because we could be supportive to each other and say, look, this is different, but we're going to get through it together. And that's the most important thing. And the most challenging thing is working with your spouse and finding that balance of where you can really support each other as opposed to detracting from one or another's thoughts and feelings, because we all have our feelings. I think as a dad, it's harder to show those feelings at times. You want to feel protective and you don't want, your spouse or your partner or, your other kids to feel that tension coming from you. Anxiety and tension in kids is largely driven by how families are responding, parents are responding to things. So I didn't want to put that on her. And it's, so it's a different process. It's not better or worse, it's just different. And I think that's where a lot of couples can struggle, is understanding that, hey, we're both going through the same thing, and that's the commonality, but we're experiencing it in different ways, and that's okay. Let's help each other in whatever ways we can to experience it in our own ways. You can't impose your way of dealing with it on anyone else. And it's like that when people come and tell you that, this is, I don't know how you would possibly be able to do this. I would never be able to handle it. And I'm like, well, yes, you would. It's your child. And when you're dealing with your child, you're going to do whatever you need to and whatever it takes to make sure that they're safe and happy and healthy.
Great point. Communication is key when it comes to your marriage and
it seems so easy, right?
Yeah.
It seems so easy, but it's so hard.
So hard. Even if you just have to tell them, I need 5 minutes, I need 10 minutes to go decompress, I need to go for a run.
Yep.
Yeah. It's just,
silence is not a bad thing.
No, silence is not a bad thing. And a little bit of space, but then coming back and being able to talk about what's going on. And
Absolutely.
Yeah. Because more than likely the other person's feeling the same thing and may not be able to communicate it, but also feel like, oh, I didn't want to put this burden on you.
Right.
Yeah.
Absolutely.
But you're both feeling it.
Exactly.
Yeah. No, absolutely. What was the first year like for you and him navigating all of the operations and surgeries and procedures?
Yeah. So we were shocked at how resilient he was. People always say, oh, don't be a baby. Well, these babies are 1,000 times more resilient than us adults. He had his first open heart surgery on day 4. They left his chest open to give him some time for the swelling to go down before they closed him up. And he was off Tylenol by like day 3 or day 4. I mean, off of the narcotics by day 3 or 4 and just on Tylenol. If they did that to us, we would be writhing in pain and screaming and calling for, the nurse and the doctor and the manager to try and get ourselves some additional medication. But they're just resilient. And so he went along with it, and he knew it was really funny. People would walk into the room and he would just stare them down. And he would basically make a decision as to whether or not you're allowed to enter. And, so there was a fellow that one night at like 2:00 in the morning, Niam had a really bad cold. It was croupy type cold, cough, and they decided they wanted to do an echo on his heart. And she was so fascinated by it that she went on for like an hour and a half. And he was just like, no, I don't want this. I'm not having it. He saw her about a month later. And the minute she walked in the door, he's like, no, and like basically shoved her out.
He remembered.
So they adapt and they learn that this is their normal for that time. I think some of the hardest parts were deciding on some of the procedures and talking to the doctors about it. And, we talk about advocacy and self-advocacy, but again, it's so hard because these are knowledgeable experts that are taking care of your child, and you don't want to feel like they're questioning your ability to be a parent because you're asking so many questions, or you don't want them to feel like you've Googled things. And so, you're going to be dismissed. But the reality is that at a good hospital, doctors should never be dismissive. And if they are, then you probably don't have the right provider. So we spent a lot of time finding the right doctors, the right therapists, the right people. And the other important thing to note about that is those change over time. So his physical therapist from years 1 and 2 was different than the needs he had at age 3 and 4. And so we had to change, and that's okay. But the first year, so he had his open heart surgery. He had G-tube placed about 2 months later. He had a number of hospitalizations. I think he spent about 90 days in the hospital during the first year.
Oh my gosh.
Um,
For what was it
a
specifically?
variety of things. It was in and out. I think he had 2 or 3 viruses. He had
Okay.
the G-tube placement. He had a couple of angioplasties, I think, during that time,
Wow.
or at least one. And so it was a lot.
Yeah.
But on the plus side, my dad had his first open heart surgery when I was 7. And he had 2 open heart surgeries. He had 4 types of cancer. He had diabetes. He had a stroke. So he went through a lot of it, and I got to go through it with him, which might sound scary, but for me, it was just fascinating.
Mhm.
I wanted to be a doctor at that young age, and I was like, oh, this is going to be great. I went to biology and realized I can't memorize anything, and that is not going to work.
Mhm.
But since he had gone through all of that from such a young age for me, I was already familiar with a lot of the heart stuff. And
Wow.
my wife, Kate, was actually a post-op transplant nurse when she graduated from nursing school. And so she was very familiar with it too. And it helped us not be so intimidated by just the medical jargon and the machines and the equipment. So I think for us, that made a huge difference, that
Yeah.
it's one thing that you're already used to and it's not as jarring. And that's the most, I think, jarring thing when you're in that situation.
Yeah. I didn't realize that background for you. And absolutely, especially when they come out of surgery. And I remember my son had tetralogy of Fallot,
Yep.
and I remember the doctors and the nurses saying, he's going to be swollen. There's going to be a lot of tubes. They
Yep.
were preparing us. So it sounds like you both had a really good background and an awareness of what to ask, what to expect.
And I think a
Um,
lot of those things kind of go out the window when you're dealing with your child too, just
I was going to
because,
ask, how
yeah,
did that change now that it was your son?
we tried to keep it together. And for the most part, I think we did. I became protective daddy bear at times, and I wanted to make sure that he was getting the best care and the best treatment that he needed. Lurie Children's is a fantastic hospital, but every hospital has its challenges, right? And that's one of the reasons that I joined so many of the boards and committees at the hospital, is because I think we can just make the patient experience better.
Mm-hmm.
And they're really, really focused on that there. So it was great to learn. Anytime you have feedback, they're always willing to take it and they'll make appropriate corrective actions. But, there was an example I can give you when they were putting in the G-tube. They said they were going to do another procedure at the same time to help reduce his acidity. And he was on Zantac from the day he was born, basically because he had reflux right away. We thought, okay, well, maybe this will be helpful, but tell us why you're doing it, aside from the fact that he has mild reflux. And, well, we're going to be in there anyway. Like, okay, that was a really bad answer. Let's try that again. And their basic idea was, look, we're going to put the G-tube in. Why don't we go ahead and take care of this, regardless of how bad the acidity is? So, well, aren't there tests for that? Yeah, but he has to be off of the antacid for 3 months or 3 weeks. And I was like, well, you just put him on it, and he can't be off of it for 3 weeks. He's not gonna be able to drink any of his milk. So they just said, that's not how it works. We can't do it that way. We can't do this. We can't do that. So I said, fine, then you're not authorized to do the surgery unless you can give me a valid reason that you're doing it. So we had, that was the fellow, we had the attending come in, and the attendings love when you ask questions at teaching hospitals, because it helps the residents and fellows learn not only about the actual ailment that you're working on, but also about how to deal with families. So we were that family that helped all of the residents and fellows learn. Um, but
That's good.
yeah, I think it's necessary, right? It's helpful to everyone.
Mhm.
But yeah, so that was hard, to try and keep our heads above water, to keep focused on what was important. It gets hard. You get sucked into the details sometimes, and you need to think, look, these people are here taking care of it. I don't need to be hovering necessarily or guiding every decision, but we need to understand what's going on and why, and be able to have input on that.
Mhm. And in those first years, what were some tips that you wouldn't mind passing on
Yeah.
to other families? Like, what were things that worked for you and your wife?
I think self-care is critical. And in those moments, it's so, so hard. But for example, when Niam was a baby, we were like, during the night, he's going to be sleeping and he's not really going to have any idea who's there and who's not. And so we should get rest while we can, because every day is hard. Every day is busy. There's doctors coming in and out all the time when you're in the hospital. You're not going to get rest there. And if you're not rested, then you can't be at your best for your child. So as hard as it is to pull yourself away, it's absolutely critical to do it while you can. For families that have older kids that are going through medical procedures as well. So Niam had his second open heart at 3.5. And, we're like, okay, we can't leave him alone now because he knows us. He's, starting to talk and he understands what's going on to some degree. And so then we did alternating shifts. My wife had the day shift and I had the night shift. And again, that's hard because you don't see your significant other. If you have other kids in the house, you may not see them as much. But, we have another surgery coming up probably this summer. And we're trying to get them prepared for it. His sister is 6 and 7, and she loves understanding everything, medical, non-medical, astronomy, astrophysics, whatever it is. She's like, yes, I want to learn it. She's a sponge. And so she's really interested to learn about what his surgery is going to be like and what it's going to do for him and why we're doing it. And at the same time, we're able to get Niam kind of up to speed on it as well. And the reason we're doing it early, there's always that challenge of when do you tell them? When is a good time, right? So for Niam, we did it early this time because he understands that he needs a tune-up. He's saying, I'm feeling slow and I need to feel better. So I want another tune-up. So we're like, okay,
So is this another heart surgery?
Yes, another open heart. So he had an angioplasty where they put the balloon through the catheter in September, and that didn't seem to work quite well enough. And so that's why they're deciding to go in for the open heart this summer. And so we decided to share it with Niam because he feels it. He feels slow. He knows that he has challenges. And so he wants to know, Mommy and Daddy, what are you doing about it? I need to get tuned up again. So tell me, how are you fixing it? And so we're like, look, we booked the surgery. He's like, I want it sooner. We're like, kiddo, it's on the last day of school. We don't want you to miss any more school. All right. So we're getting it done as soon as we can. You're going to feel a lot better afterwards, but it's going to be scary. But the hard part is when parents are emotional about it, when they're talking to their kid or when they're scared themselves, the kids feel it. And so then they're going to be more anxious and more scared. So before we were able to talk to him about it, we had to be okay with it ourselves. We had to process it and understand that this is the right thing. It's the right time. It's going to help a lot. And hopefully it puts off surgery for another 10 years, heart surgery for another 10 years.
Yeah. So how did you and your wife prep yourselves?
I think we processed it about a year before because they had said that he might need surgery in 12 to 18 months. And so we had already kind of had in the back of our head, this is coming at some point. And if the angioplasty works, great. Hopefully it'll buy us another 3 to 5 years. But at some point, you're going to have open heart surgery again. So we had started processing it then, and then it becomes reality when you go and see the doctor and he says, okay, I can see that, he's having challenges. But it makes you feel good to know that, look, they're paying attention. They are working as a team. Our cardiologists immediately said, look, I see the challenges. I know that Niam knows his body and you know his body. So when he says he's slowing down, I believe it. He went and talked to the interventional radiologists in the cardiology team, and he talked to the cardiothoracic surgeons. They had a big conference, and they, as a team, decided that this is the right way to go forward. So it's comforting to know that the decisions aren't being made in a vacuum. The surgeons are involved, all the teams are involved, and they said, look, we can do another intervention through the cath lab, like a angioplasty or a balloon, but it may cause problems for future surgeries. So let's just do the surgery now and clean it up, and then we can do other interventions when needed.
Right. Sounds like you have an incredible team.
Yes, we really do. We've worked really hard to assemble it.
Yeah, that's so great that you have all of those people looking at it and analyzing it and asking questions about it. That's great, because not everybody gets that.
Self-advocacy, right, is finding the right institutions and the right people to help care for your child.
Right.
Some hospitals say that once you're seeing a provider, you can't switch. And I fight that every time. I'm like, look, I need the right fit for my kid. and the right fit for the family. Otherwise, we're not going to make very much progress, and it's not worthwhile.
Yeah. And that comes with time. You
Yes.
know, your advocate voice comes as your child grows, as you experience things, new doctors, new nurses, it just comes
And you get
naturally.
comfortable with it as you
Yeah.
kind of own that, yes, this is 22Q. Yes, this is our family. Yes, we're learning exactly what we need for our child. And so the children, when they can be, are their own best advocates, especially with their parents, to be able to tell their parents what's going on. But then the parents need to be able to translate that to the medical professionals.
Yeah. And what has been the biggest struggle for you as a dad through all of this?
I think the biggest struggle has been that aspect of wanting to be protective of the whole family and not kind of bottling up some of that stress at times. I think it was easier when he was a baby to have those open conversations with people. And at some point, you realize with any sort of difference that people have a lot of opinions. And the more you talk about it, the more opinions you get. And so I think I got to a point where I was like, I just don't want any more opinions. I understand what we're doing. I understand what we think is best for our family. And I'm happy to hear people out, but I don't want to be solely driven by that or solely guided by that. And it's like if you get a procedure done yourself and people keep asking, oh, what happened there? Oh, what happened there? Oh, what happened? You just want to record it and say, this is my response, right? And so it's kind of the same. You don't want your kids to feel like they're different. You don't want your kids to feel left out. You don't want your extended family worrying. You don't want your spouse to be concerned that you're struggling with it. So I would say that's one of the hardest parts, is to continue to have that open communication.
And as the dad and as the leader of your household and the provider, and I am the one going to take care of everybody. And it must be so hard carrying that and sometimes not being able to fix everything.
Not being able to fix is hard, especially for me. I'm a big fixer, and that's part of my involvement in all of these nonprofits, is to say, look, we can do things better. So let's all work together to make it better. And when you can't, it's hard. It's like, it's a blow. And this is my family. What do you mean? I can fix things for other people, but I can't fix things for my family? That's it's not an easy one to process.
Yeah, it's not. It absolutely is not. But it sounds like you're doing an incredible job with your advocacy work and all the boards you're on, and just being able to analyze the situation and say, no, that's not right for my son, that you're doing it. It's just in a different
full-time
form.
job, right? Like for families, we're incredibly fortunate that our insurance is fantastic. But, one of my biggest challenges is for people, broadly speaking, that have to work with insurance companies and that have a lot of limitations and exclusions, is how do you get care for your child? It's such a challenging area and such a challenging issue. And that's something that we talked about at the Lurie Family Partnership Council. Is I'll give you an example. When Niam was in the hospital for his first year, the hospital billed $1.25 million. And our out-of-pocket was $400. We had to pay $200 in 1 year, $200 in the next calendar year. So we were incredibly fortunate, whereas most families don't have that level of coverage, and it would have been a huge burden. I did spend $12,000 in parking over that year.
I'm sorry, I laughed. We did too. I hear you. It's insane.
That's part of what we set up at Lurie's, is a parking fund, for families that are coming in and spending so much time. If the medical care doesn't bankrupt you, this very well may. And again, we were fortunate that Niam was only in the hospital for about 90 days during his first year, but had he been there more, it just adds up. And there's so many families that don't come home for a year or even 2 years or longer, with their children just not well enough to actually leave the hospital until they're a little bit older. So, we need to figure out better solutions in this country for healthcare, because the system just isn't working. And I get there's issues with all of them. For example, some of these countries with nationalized systems are now debating for treatments that are expensive for individuals. Do we approve them or not? Because you're spending $1 million for treatment on one person and you're spending $500 on another person. Where does this money come from? and how often can you spend it? So no system is perfect, but I think that we need to work on our system quite a bit, because parents have to choose now, can I get OT done? And do I have to choose between OT and PT? Physical therapy and occupational therapy can both be critical components of helping our kids be stronger, healthier, better versions of themselves. But when you have to make that decision, that's incredibly hard, and I don't know how people do it.
Yeah, it's a huge issue, and it's a mess, and it makes no sense sometimes. But when you do open those medical bills, you thank God you have health insurance.
Yeah.
For those of us that do, because we had a similar bill after my son's first year of life, because he had 3 operations, and you open those bills and you're just like, oh my God. Like, it's crazy. But yeah, navigating all of that is a lot. Absolutely. And in your role and as the dad, and you had mentioned sometimes people say the wrong things, what do you wish sometimes when you were in the thick of it, his first, second year of life, what were some things that you wish people would have said or done that they could hear today and learn from if they have someone that's going through something similar?
I think the best thing that people can do whenever anyone is facing adversity is ask, how can I help? What can I do? We have enough experts giving us advice and telling us what to do with our child that at this point, if you want to support us, support the person, support the family unit. And if they have another child, then great, maybe I can take so-and-so out for an outing this day and do that. We already have people for the summer lining up when Niam has his surgery to take Amaya to do stuff, like, oh, she's going to go shopping one day with this person and spend the night with this person one day. And, try and kind of make it exciting for her too. And have her not just feel that, well, I'm left alone here and everyone is just focused on my brother. She's going to get some specialized attention as well. And I think that, those people came and asked us, hey, we know this is coming up. So what can we do? What's going to make it easier for you? What are you concerned about? What are your biggest challenges? And how can we help?
Yeah. Great advice. Or pay for my parking at the hospital.
Exactly right.
Buy me a Starbucks card.
Exactly.
I'm going to need caffeine.
I need to be well caffeinated at all times.
Right. I've always gotten, whenever any of my friends are in the NICU or going to be in the hospital, I always get a neck pillow and a Starbucks card. And they're always like, thank you so much. It's like, unless you've done it, you don't know the little thing.
Absolutely.
Yeah. So did you get the diagnosis of 22q in utero or after he was born?
Yeah, we got the diagnosis in utero.
In utero. So when you got that diagnosis, what was that moment like for you?
It's just kind of shock. You wonder, did we do something wrong? What could have changed this outcome? And the reality is nothing, right? This is a de novo mutation. It is a random mutation of a gene. We got tested ourselves. Neither of us were carriers of the 22q gene. Neither of us had 22q. And so it really was that 90% that's just a random mutation. But you want to find someone or something to blame. You don't want it to just be random stuff happens in the world. You want it to be, well, why did this happen to me? And, I think we just took solace in the fact that, look, he's going to have challenges, but it could be so much different and it could be so much worse. And, with any situation, I think that's always a good perspective, right? Is to stand back and say, look, I'm dealing with this, but it could be a lot harder in a number of ways. And that doesn't mean that it's not going to get harder. It does. You can be in a good spot and think that you're dealing with hard stuff and things can get harder and you feel like you're in a little bit of an abyss. But for us, when we got the diagnosis, it was okay, let's process this and understand that it's not our fault and try and internalize that. I think my wife still struggles with that. And then what now, right? Like, what do we need to do that's going to be different from a normal pregnancy? And for the pregnancy itself, it was basically the same, aside from the fact that he got echoes every other week or every week. After that, obviously, it makes a difference. And the more you can plan ahead, for us, that was helpful. So to know that, look, we've already met the cardiology team, we've already met the surgeon, we've already met, the staff that's going to be taking care of him. That made it more real, but also easier to process because it's more tangible, right? It's not just a diagnosis where, hey, your child is going to has 22q, and you have to process, you have to deal with that. It's more of a, for us, when the rubber hit the road and we kind of actually started meeting people, that was how we really were able to actually start processing it.
Mm-hmm. Mm-hmm. Yeah, because at first, what was it like for you? Was it scary? Was it?
Yeah, I think it was just, it was nerve-wracking because you wanted to make sure your child is okay. And, it's like, did I do something that is going to make him not feel okay or not be okay? Or even if this is normal, what does that mean for his future?
Mm-hmm.
And, when you start Googling these things, it's a terrible idea. It gets scary and you go down the rabbit hole. So I think that's why organizations like the 22Q Family Foundation are really, really helpful. You can immediately get in touch with a
Mm-hmm.
huge community of people that care and that have been there and that are conversational about it and willing to connect on it. I would say that he is absolutely a lover of life. And by that, I mean that he loves being loved. He loves hugs. He loves the things that he's involved in and engaged in at the moment that he's engaged in them. He's hilarious and is able to kind of put the world into perspective. And it's just amazing to watch.
Yeah. He sounds awesome.
Yeah, he's a lot of fun.
Yeah. Oh, that's wonderful. And if you could go back in time to when you got your diagnosis and you could actually physically go back to you and your wife in that moment, what would you say to yourself, having 9 years
Yeah,
experience now?
I would say, look, it's not easy, but you can absolutely do this. You
Mhm.
got this. The two of you, me, and your wife, the two of us have it. You guys are going to pull together and you're going to be great.
Mhm. Mhm.
I think that that level of encouragement, that look, yes, there's hard days, but there's so much more good than there is challenge.
Mhm.
Um, you just have to be able to appreciate that. And
Mhm.
I think that's the hardest part too, is because you're always worrying about what next, what do we do, how do we help. You just have to enjoy the moments. Uh,
Yeah.
it's so hard to do sometimes, but enjoy the moments while you can.
Yeah. Yeah. Great advice. And if someday Niam listens to this, what would you want him to know how you felt about him?
That we love you with all of our hearts, and we want you to be as happy and comfortable as possible in life.
Mm-hmm. And that you're an awesome little kid.
Yes, absolutely right.
Yeah. Kapil, thank you so much.
Oh my
This was
gosh, thank you,
wonderful.
Becky. This was a great opportunity.
No, you were magic and it was wonderful. Thank you again.
No problem. Thank you. You take care.
Kapil, thank you so much for being on today and sharing your perspective as a father. It's so important to hear both sides of the family's perspective, and I really appreciate you being on today. Keep doing all the amazing work that you're doing, and I wish nothing but the best for you and your family. Thank you again. And to all of our listeners, thank you for listening and subscribing to this podcast and helping to raise awareness about 22q. If you'd like to contact me, you can email me at 22qpodcast@gmail.com with any questions, or if you would like to be on this podcast, let me know. And 22q family, never forget that you are not alone.